Hi guys, welcome to We're Menstrual, the podcast, a series of conversations about the ebbs and flows, literally and metaphorically, of life, and a safe space to talk about periods. So today's guest is a gynecologist, which is really important for this topic of conversation. She's a gynecologist, she's a women's health advocate, and she's actually one of the most inspirational and valuable people I've met in a while. We had an initial conversation, like how we met was like, we'll actually get into that. But I really have gleaned a lot of wisdom from her in the short time we've known each other. But I'm really honoured to have Dr Israa on the podcast.
Oh, thank you.
And
thank
the crowd
you.
cheers. How are you?
Thank you, Candace. I'm good. I'm
Good.
really, really good. I'm really excited to be here because, like you said, I think the way in which we met and also what we've been talking about in such a short space of time has kind of really inspired me. You say you inspired me just because it's so beautiful to see someone who's, really dedicated and passionate about something that is so important and needs to be talked about, needs to be highlighted.
Yeah.
Thank you so much for having me.
Oh, thank you for coming. So, in short, how we met. I went to Black Unity Bike Ride.
Unity Ride.
Yeah. So essentially, it's a collective of Black cyclists. I actually can't remember the Tops. I think runs it. A guy called Tops runs it. Essentially, it's an annual event where people come together to community, like a community bike ride, essentially.
Yeah.
And I was gonna go, and in my mind, when I knew it was happening, I thought, you know what? Because I did the launch called On Your Cycle, I thought, let me go to the Unity Black Bike Ride and hand out flyers about that, kind of talk to it from when I knew that the cycle was happening, I had that thought like 3 months before. But I just forgot about it, I didn't action it, and then the day came. And my friend who knows the founder, she rang me like, I'm going to Unity Black Bike Ride, do you want to come? And I initially was like, yeah, and then I was like, actually, no, I think I'll just relax, Then she was like, no, you have to come. I think it'd be a great way to connect the dots, blah, blah, blah. And I was like, I know. I even wrote it down 3 months ago. I'm so annoyed I didn't think about that.
Right.
Cut a long story short, she had some credits on Snappy Snaps to print some flyers. So I didn't have any flyers left.
Right.
So I was like, I don't want to go there and just talk to people. I want to be able to give them something. And she was like, do you know what? Let's just see how many flyers my credits can print. Just design something so quick, send it to me, I'll just print it and we'll just go down.
I didn't know all of this.
Yeah.
There's even more of a backstory.
Yeah. So we just did that and I literally was like, I'm not a designer. So I literally was like, okay, I'll just put this on it, make sure the QR's there, put this social handle, printed it, she printed it, and then we were like, all right, cool, we'll just meet there. So I drove down, and I think I got there and there was 45 minutes to go before it was finished. By the time we had that conversation, the things got printed, I drove from Enfield, all of that. So I started handing out flyers and people were really receptive. Yeah. One woman said to me, which I'll never forget, she said, thank you so much for doing this. And I was like, oh, that's so lovely. Not that I felt demotivated at that time, but I think at the beginning of any new journey, it really is about how do you keep your momentum wheel going? Exactly. And it was going and then slowing down and going and slowing down. And at that point, it was kind of in the slowdown. So when people were being really encouraging on that day, I was like, this is signs that I'm doing the right thing. And I also wore purple trousers. I had a Gynae Project branded bag, blah, blah, blah. So everyone's like, oh yeah, all matches, da, da, da. And I thought, okay, great. People are associating me with it. And then I got to you. So my friend and I both had flyers and she was like, oh, have you done those two ladies? No. She's like, okay, cool. And then I said, I'll do them and you do them and I'll do the other two people that she saw.
Yeah.
So we split. We came over to you, I came over to you and I was like, hi, basically my name's Candace, can I give you a flyer, blah, 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 this, that and the other. And I remember you were like,
Well, it wasn't. So it was so funny because me and my friend, I was there for my friends.
Yeah.
She's got twins, and it was their birthdays.
Oh.
And then her husband as well as part of the Black Unity Ride. So I came and she was like, "We're not doing a birthday for the girls this year. We're just going to do everything at Black Unity Ride." So I was like, "Great, it's a nice day, Dulwich Park. Why not?" And as we were walking, me and her were just catching up, walking around. And then when you approached us, and I just saw the Gynae Project in big letters, I was like, is this a sign? Because you gave the flyer to her first, and then she just looked at me.
Yes,
she looked
I
at
remember
you.
that.
There was like a whole like
I remember
three-way
that.
like awkward silence.
Yes, exactly. I'm so glad I was like, in my mind, I was thinking,
you're like,
what's happening?
Yeah.
What's going on?
And then she was like, you are giving a gynae project flyer to a gynecologist.
Yes.
And then I was just like,
Hi. And I was like,
so
you're like, yeah, I'm a
it was
gynecologist.
just like a moment where there was like, I don't know, kind of like electric energy between us. And we both like, we all didn't know what to say. And it was like the silence.
100%.
And then it was like, oh my God, tell me more,
Yeah,
you know?
yeah.
And then you could just see the sparks at that time. So
honestly,
it was a beautiful moment.
Yeah.
And it was very organic.
Yes.
And it was meant to be,
yeah,
I think.
no, definitely.
You know?
Because I remember you saying you meant to go to a wedding that day.
Yes. I wasn't supposed to be there.
Yeah.
Yeah, I was supposed to go, somewhere. My parents had a wedding thing in Reading somewhere. And I don't know what changed my mind. I can't remember, but I ended up coming to Dulwich Park.
Yeah.
And so,
literally.
Everything happens for a reason.
Everything happens for a reason. It's all divine connection.
Exactly.
So, yeah.
And since then, we've just been
non-stop.
Yeah.
So, I can't wait.
Yeah.
Essentially.
It's exciting. I'm so excited. And I'm so very impressed by you because you've come into a world that's, could be very contentious and very difficult. And, there's all the taboos, and I know we're going to talk about the stigmas and the shame and all of that. But also from a point of view for Black women, this is an area as well that kind of holds a lot of pain and holds a lot of just difficulty in general from all aspects. And it's really nice for me to see somebody who, from the medical side of things, we're always like, campaigning for specific things within kind of period or menstrual cycles and period poverty. But it's really nice to come with a true, genuine story. That's how your journey started.
Yeah.
And I love that because it just seems so authentic and intentional and, real.
It is. And initially when I started, I did think, I have really not come from this world. And a lot of it is about the medical, it is about the science, it is about the clinical. So I thought the only thing I've got to, not the only thing, but the main thing I've got to bring to this is my real life experience. And that is what I'm leading with. Yeah. And we'll just see where it goes.
Yeah.
See where it goes.
Yeah. You can't lose that way. Because that's,
you're right.
That's so authentic and real. There's nobody can tell you, no, you're not doing the right thing. They can't. Yeah. There's just no way because this is your journey.
It's my journey.
Experience.
Exactly.
And you'll find that other women relate to you much more because of that aspect as well.
Yeah. Yeah. I think, I've got big hopes and big plans, as we both know.
Yeah.
So, I'm looking forward to just seeing how it all expands. But on the topic of experiences, do you remember when you started your period and what that was like?
Yes. I was at school. I think it was primary school or first year secondary school. It must have been, I reckon it was like year 7, year 8. So I went to, this was the school when we were living in Reading, actually.
Okay.
And me and my best friend at the time, her name was Halima, we were in the toilets. You know how girls go together, toilets, during break time, and I'm chatting to her whilst I'm washing my hands. And she's in the toilet, and suddenly she's like, "Oh my God, I've just found blood. I think I cut myself." I was like, "What do you mean you've cut yourself? What have you cut yourself with?" And we're talking through the toilets.
Yeah.
I was like, "What? Let me see." And I barge in like, "What have you done?" And I was like, "I think this might be your period. I don't think you've cut yourself." And if I pause the story there and go back, so my dad's also a gynecologist, and he made sure that whatever we were taught in school, he reinforced at home. Yeah. And so
That's
when
really
it came
refreshing.
I think I was very lucky in that aspect. And I think when it came to sex education and what we were doing in biology in school, he would always come and tell me what they told you. Yeah. And then he would reinforce kind of in his way. Yeah. So I have 3 brothers. I'm the only daughter. Okay. And so we all had that conversation in the biology kind of more academic kind of conversation. Yeah. Using very terms, medical terms, really, from quite an early age, because that's what he knew.
Yeah,
and
yeah.
that's how he knew how to teach
communicate.
it.
Yeah.
So I'd already had that talk. So I'd already known that, when a girl goes into puberty, the period comes and it's the shedding of the lining of the womb. And, so all of those things kind of I understood. And so I was more prepared than Halima. And I told her, like, I think this is your period.
Yeah.
And she came from a very conservative Pakistani family.
Yeah.
And so none of those conversations, she was actually taken out of sex education at school.
Oh, really?
So because her family didn't
Want
want to, which is part of the conversation we'll probably have about the cultural aspects of kind of period education and sex education in general.
Yeah.
So she had no idea. And I said to her, I think this is your period. You're getting your period. And then, stuffed some tissues down there.
Yeah.
And I said, maybe you can go speak to the nurse.
Yeah.
And she didn't want to speak to anyone.
Really?
Because she's just so embarrassed and culturally as well, such a shame, such a taboo. And she went home and she said that she stuffed more tissues in her pants. And I think when you first get your period, it's never like a heavy flow. It's like little droplets. So it wasn't too bad.
Yeah.
But yeah, she was so embarrassed. And then the next day she came and I can't remember who, but somebody had a pad. So we were all in the toilets, handed over the pad over and showed her how to use it. It was like a little group effort,
That's so sweet.
And we were always checking on her and, because none of us had it, but a lot of us knew what it was and just felt so sorry for her at the time. And then I got my period a couple of months after that.
Okay.
And so I felt kind of prepared. And then, I went home and told my mom, and my mom was the one to kind of tell me how to clean yourself, to use pads. And I come from a Muslim background as well. And my mom was like, no tampons, don't put anything in there, not even a finger, And so it was just pads, and then kind of just checking on me and checking on like how do you feel today and what, because when you start your periods, it's not just physically the blood that's coming out of your it's not just the period. There's a lot of emotional stuff, hormonal stuff that goes on, and so she would check in, but as a teenager usually at that time you're like, oh, just go away and so it's so I was actually quite lucky in that I did kind of know what was coming, but I know a lot of my friends, and I've been since we had our conversation, I've been asking people, when did you get your period? Did you have that conversation? Because I do think it's formative. I think if it's really traumatic when you get it, I had a friend that I spoke to quite recently. She had no idea when it came, and it usually comes at school because we spend most of our time at school. And she said, my mum didn't tell me. And then when I went home, she said she got sent home by the nurse.
Okay.
So again, you're like excluding that person. Yeah. And when she got home, her mum said to her, okay, well, you're a woman now, and this is going to happen every month, and it's going to hurt.
That's such a different messaging. And
so you can see how that plays. So even when I asked her about her periods, she was like, oh God, what are you going to, I think that she already, exactly. And so I think it's really important, the conversations that we have, especially with young girls and boys, and how that then, kind of formulates how they think about periods, whether they appreciate periods or not, whether they understand why they're having them. So it's super, super important. And I think we all need to maybe do a little bit of reflection on our first time and what happened and what the conversations were.
Exactly. And as you said, I think you were really fortunate in having parents who were like open to having that conversation. And I think for so many, it is that taboo, it is that shame, it is that embarrassment. As much as it is a sign of like, okay, you're coming into puberty, which is a sign of growth and like womanhood and like almost like a graduation from that adolescence into the next phase of like womanhood, there is that taboo and shame that is circled around it. From a Western point of view, firstly, where do you think that comes from?
I think, if I could sum it up in one word, patriarchy.
I was going to say 1, 2, 3.
Exactly. I mean, I think it is from a Western, from an Eastern, from all angles when you look at it and when you do some deep diving on why we think about periods in such a negative way, it's really based in patriarchy. And it's this kind of, it's, how can I say? It's this notion of like when you're on your period, you're unclean, you're impure. If we even think about the names for periods, so if you sit and think of a list of what we call periods in, say, colloquial terms, you know, there's terms like on the rag, the red tide. I remember one of my French friends taught me this, and she said in French they call it what is it? Les Anglais débarqués or something, which means the English have invaded. So
What?
Yeah, so there's all the ways that we describe periods or have these euphemisms for periods are generally quite negative. If the symbolism is red and blood, or it's some sort of witty humor that men have created. I mean, the English have invaded.
That's mad.
And I think the Germans talk about Moscow or the Russians invading. So what is that about?
Yeah,
You
even
know?
code red.
Yeah.
I've had that.
Code red, exactly. The Crimson Tide.
Yeah.
You know, there's this, it's crazy. And when we did this little exercise one time where we looked at different ways of kind of describing you being on your period in different languages. Very few languages had a positive connotation to periods. I think one of them was Swahili, where in Swahili, when you say you're on your period, you say something about, I think it's Mother, I've been gifted by Mother Earth.
Very different language.
Very different language. I think Koreans as well say something along the line, I'm in my magical phase.
Wow.
Which is beautiful.
How would that change? That would change things massively.
Imagine.
That would change things massively.
Yeah, but everybody else, I mean, of course, there's the kind of regular, I'm on a period, I'm on a cycle. It's the time of the month. Which is very neutral. But I still feel like it has a little bit of a, oh, I'm on my period. Oh, okay.
There's that.
Yeah, there's this kind of, you know, let's leave
you alone.
Be. And I think, in general, I think people think as menstruation as something that is just dirty and women should be left alone at that time. I think there's something in that kind of seclusion idea, because I think originally in a lot of maybe African and Indian cultures, actually, there was this concept of a menstruation hut or a space where women would go and menstruate and do what they need to do freely, away from everybody else, away from society. And I think it was a way of, it could be viewed in, I think in some cultures it was viewed positively and then in others negatively. In some cultures it was, you go away to this place with other women, you menstruate and do what you need to do freely so that you don't bother anybody else. Or you go and rest. It's a period of rest where you are, you know, kind of taken away from your daily chores and you're just resting. And then there were some cultures that looked at it as you were a bad influence or a bad omen. So menstrual blood held this like negative kind of, in some spiritual, you know, if you're near somebody who's menstruating, they can contaminate you with bad spirits. So there's some cultures that thought that way, and then that's why they secluded women. So it's really, you know, where does this all stem from? Like who said menstrual blood is evil and it carries spirits and you can contaminate other people? And I think some of it as well stems from religion. I think some of the religions as well see menstruation as impure. You're unable to pray. How is God not going to accept your prayers just because you're on your period when he gave this to women? He made women menstruate every month for a reason. It just doesn't add up.
Doesn't make sense.
You know, and in some religious practices, women can't touch their men when they're menstruating. They have to sleep in separate beds and they have to like isolate themselves. They can't even touch food.
Wait, hold on. As in touch food to prepare it?
Yep. Yeah. And this was actually a story that was told to me by a patient. She was an Orthodox Jewish lady.
Okay.
And I learned so much from her, as I do from many of my patients.
Yeah.
And she said that in specifically in Orthodox Jewish religions, when a woman is on her period, she has to separate herself from her husband. So they sleep on separate beds. She's not allowed to touch him. And then when she does come to prepare food, she has to wear gloves because she's not able to touch the food. So I'm sure there's like deeper meanings and things for that, but she came to me to say, I need to know that I'm not on my period, because she was bleeding and I think had an infection. So she was telling me, I need to know that I'm not bleeding so I can be with my husband again. And I was very shocked,
Blown
to be
away,
honest.
man.
Yeah.
Blown away.
Because I had never heard of this.
Yeah.
And they have certain rituals that they need to do. In Islam, it happens as well. You have to do a ritual wash after your period so that you're cleansed again.
So after it's finished?
After it's finished, yeah. After it's finished. So I know that happens in Judaism and in Islam. In Islam, there's no such thing as not being able to touch or, you know, you can't pray, but you can still enter a mosque and so on.
Yeah.
So I think a lot of these kind of cultural beliefs and even social norms do stem from religion.
Yeah.
It'd be interesting. I haven't looked into other religions, the non-Abrahamic religions, like say Buddhism, Sikhism. It'd be interesting to see what they say as well. And then of course, you know, for us as Africans, African Caribbeans, Black people in general, there's just cultural norms.
Yeah.
You know, that she's on her period. You know, there's this social stuff that we also come across a lot when it comes to periods and how men perceive women premenstrually or on their periods or when are you ovulating now? You know, it's there's a lot to unpack there.
Yeah, there really is. I saw a meme, not a meme, reel on Instagram saying this guy was going on a date and he said, can somebody help me get the girl I was going to date out of her luteal phase? I don't know what that means. Like, is it a phase that lasts a day? It was actually really funny. He was like, is it like a day? Is it like 10 weeks? When will I go on a date with her? I really want to go on a date with her, but can someone please help me? What does a luteal phase mean? Is it because her star sign is this? I was actually cracking up. But I think that even that, like, understanding the phases of your cycle is something that's like become a lot more, I guess because of the world I'm in, I see it more. Yeah. But I think there's something to be said for understanding the phases of your cycle and working with them, which I'll come back to. But keeping in the same vein of taboos, medically, because obviously you were in practice, you've seen it day in, day out, up close and personal on the front line. What are some of the like interesting stories or reasons people have come to you for your specialism?
I mean, it's quite varied because I look after women across like their life cycles. So, you know, we deal with periods, fibroids, childbirth, menopause, and I never see a woman in just one entity. It's a spectrum of things. Yeah. And then within that spectrum, you've got so many other factors that come into being a woman. You know, it's super complex, which is what makes us incredible and beautiful. Yep. And the majority, so if I could pick some of these, you know, the real stories is probably when I worked in either St. Thomas's or Lewisham, which is Lewisham specifically being a high number of, you know, Black and African-Caribbean women. And a lot of the time they come with such severe heavy bleeding and thinking that this is just normal for them. This is how they've always had their periods. It's always been super heavy with big, massive clots. And that's just, you know, my mum had heavy periods, so do I. And never thinking to seek help because that's been normalized in such communities. And it's only when they come and, you know, come for something else in clinic.
Yeah.
And then I ask about a period. No, how's your periods? Are they regular? How heavy are they? You know, and even that question is really difficult to answer. How heavy are they?
Yeah.
You know, how many pads do you get through in an hour?
Is that the best way to measure heaviness?
It's very difficult because it's subjective. What some people's heavy may not be your heavy, and what some people's light might not be your light.
Yeah.
But you have to ask more specific questions. So I ask things like, obviously, how long do you bleed for? But in a day, how many pads do you use, pads or tampons? How many of those do you go? That could give me a little bit of a gist of, because, you know, if you're changing your pads hourly, that's a lot. And are you using regular pads, night pads?
Yeah.
What kind of pads are you using? Some women double pad.
I knew a girl that did that.
Yeah, and some people use tampons and pads as well. And then, you know, we get a little bit deeper into it. Like when you do bleed, what kind of, is it heavy bleeding? Like, for example, like if you're having a nosebleed, is it fresh bleeding that just trickles down your leg? Or is it big clots? If the clots are there, what size clots do you have? So we try to, you know, it's very difficult to get the history because some people actually don't even look.
Yeah.
And can't describe it. And then others are very descriptive, so which helps. And so there isn't a very formalized way. You kind of have to be, it's really based on the doctor and how good your questioning is and what kind of idea you can get. Otherwise, heavy bleeding is just heavy bleeding, which is a shame because we know statistically that Black women get heavier periods and are more prone to anemia because of things like fibroids or just generally some menorrhagia is what we call it. It's the medical term.
Okay.
So basically it means heavy bleeding.
Got you.
And we know that, as I said, Black women are higher risk of having menorrhagia, but we're not seeing Black women access the services as much as they should do because they just think this is normal for them.
Yeah.
You know, because the conversation at home could be with their sister or their aunt and they could say, oh, well, I also had heavy bleeding. That's quite normal for me. And they may have just pursued and continued on. Whereas for you, it could be really difficult. I actually recently had a friend who's a doctor. She's Black. And she was severely anemic. She's just been plodding through. She's got a little young son and she works as a doctor, you know, long shifts and so on, and collapsed at work one day.
No way.
And it was because she's anemic because she just gets really heavy periods.
Wow.
And she hasn't even thought to kind of get help.
And she's
in the system, you know?
Yeah.
And she's an anaesthetist and she's someone who puts women to sleep for certain operations. So it's not like she doesn't, you know, but it just shows you in that, like, we normalize, like, no, I've just got to get through this.
Yeah.
I've got to get on. This is just my period.
Yeah.
It's going to be done in a couple of days.
Yeah.
And you don't stop to think.
Actually, is there something more here?
Yeah.
And I also think there's a level in some ways around distrusting the system.
Yes.
And because for so long, and especially, I think it was even as short a time as 100 years ago, where Black people, medication was being tested on Black people. So for a lot of Black people that are generations and generations, that messaging from maybe their grandparents has come down like, no, you can't go there. They used to do this to us, blah, blah, blah. You'll be fine. Just take some ginger, just take some garlic, just take some clove, just take some. All of these things are really important as well, like the holistic approach. But I think what I've learned in my, I'd say definitely in the last two or 3 years is the importance of merging the two. So looking at like what are the medical things that I should actually be seeking? How should I be getting advice from a clinical point of view? But how can I pair that with the agency I can take in taking a more holistic approach to my life? And then how do they marry at the top? Because there's definitely, I think that sometimes stops Black women in particular in seeking help in the first place, paired with, oh, my sister said her period was really heavy, so yeah, I think that's just hereditary. And maybe it is, but at some point, it's a bit like generational anything.
Yes.
Like you kind of either got to cut the tie or like make the change.
Exactly.
So yeah, I think there's a lot to be said for how we get here in the first place and how we don't move past this.
We're stuck. We're stuck.
Yeah.
Yeah, because and I think everything that you said there falls under self-empowerment. Because when you're empowered and when you understand your own health first and foremost, then you're able to navigate the healthcare system. You're able to navigate what information is good and isn't. Also, what information works for you and doesn't. Because there's so many things out there that, yes, may help people improve their cycles and so on and so forth, but does it work for you? And it's only until you try it and then make a decision. And I think that's really important. I'm such an advocate for kind of your own self-health empowerment because if we don't know our bodies and don't know what's going on, I encourage women to look at themselves down there. When you have a clot, when you pass a clot in the toilet, have a look at it. What does it really look like so that you can explain to the doctor? Also, know your cycles in and out. Keep a diary, keep a journal. There's like so many apps at the moment that are out for everybody tracks their periods. You know, there was a time when I'd be in clinic and I'd ask a lady, when was the first day of your period? And I think it was last month. I'm not sure. And you need to tell me I need to have this information to be able to help you. So you also need to have, kind of your agency and understand your body a lot more so that I can help you. And I think we're at an age now where technology has helped and we're a lot more aware. Social media has helped. People sharing their stories has helped. Doing things like this, when people are hearing about certain stories or certain anecdotes or anything that can make them understand and say, actually, I went through that. And I understand that as well because it's my own personal experience. So I think that that's really important. And I think we're in, hopefully, an age now where we're taking more ownership of our health and helping ourselves first.
Absolutely. From a self-empowerment angle, just slightly away from the conversation but linked, where do you think your passion for self-empowerment, or when did you feel like actually self-empowerment is really important? What did a situation happen where you felt you didn't empower yourself and then you thought, you know what, I need to learn how to empower myself? Where did that come from?
I think for me, because of the work that I did and being in front of a lot of patients that needed my help when I felt a little bit helpless because I didn't have the information needed. I think that's where it started. So I would then say to them, if you don't know when your period has started or you don't know when your cycle is, it's really hard for me to give you that tailored and personalized advice and treatment. So I need you to go away and think about what it is that what's the information you need to collect and collect that information. And I think as I advise certain women, I was doing it as well. And I was like, okay, I do track my cycles because as we all do, sometimes, you're planning trips. There's so many things that goes into it. Like if I'm traveling, like, all right, am I going to be on my period because I need to figure out am I going to be on the flight? Am I going to be landing? Is it going to be the first couple of days or is it going to be the tail end? So things like that, when you're just generally planning life, I think that's really, really important. And that comes into ownership and empowerment. And I noticed that a lot of women do not know, like, the menstrual cycle or what is the menstrual cycle for, and think that, period is a nuisance and I need to get rid of it. The amount of women that's like, I just want to get rid of my period. And I'm like, really? Is that what you really want? Because actually your periods are a normal phenomenon. Like it's part of who we are. It's a gift, like that Swahili saying, and why do you want to get rid of it? I understand that if you have really horrible and bad periods, of course you're like, I don't want this. I don't want to feel like this every month. But if you seek the advice and the help and see if we can help with those symptoms, your period is something that is natural. And I do understand there's groups of women that having their periods, it's hell on earth. And that's, I'm not dismissing that. But to get to the diagnosis, to get to why that's happening, we also need that information. And I think self-awareness and education is so important when it comes to the human body. I'm such an advocate for listening to your body, whether it's your skin, whether it's your vagina, whether it's your hair, whether everything.
Yeah, man, I agree with that.
Yeah, we need to listen, because how else are you can't rely on doctors and external help to help when you don't know what's going on.
Yeah.
So there's that. There's also, I worked developing some digital health programs for WHO, the World Health Organization, and it was based around improving access to things like contraception and sexual health in all over globally. And what I worked with a group who were basically, they wrote the guidelines for something called self-care.
Okay.
Not self-care, not in the way that we think of self-care, like having a bath on a Sunday,
candles,
and exactly, which is self-care, but this is more in a clinical terms, self-care interventions.
Okay.
So how can we use self-care interventions to improve our autonomy and improve empowerment of our health? And it's things like, for example, we started it in COVID, actually. We actually got to do it without knowing, and it's self-testing. So things like self-testing for COVID, which we all did. Now we've got self-testing for STIs. So you can now order a test, or you can do your own STI. You don't have to go to the clinic. Self-management of conditions like diabetes, for example, or self-management of your blood pressure at home. So we're taking away that pressure on doctors and healthcare providers. And we are providing the information. And then we're also at the same time learning about ourselves. So when you're doing your blood pressure at home, you're like, oh, I know that that's a high number, or I know that's a low number. Or today's readings are pretty good. What did I do today? Oh, yeah, I went to the gym. So we're learning a lot more by things like that. And then, of course, there's a lot of technology that's helping us as well. Things like the tracking and so on. So I was really interested and fascinated in self-care interventions and where it can go. So we worked on programs like self-testing for HPV, which screens you for cervical cancer, self-testing for HIV, and especially in areas like rural areas, for example, on the continent, Africa, or anywhere else where they don't have access like we do to screening programs. This is incredible. This is revolutionary. But also, it's not just going in and testing yourself, but I was very adamant that when we produce these digital programs or apps, for example, we're providing education. So what is self-testing? What is cervical cancer? What is HPV? So that the person that's using this is also learning as they use these products. And so I thought that was such a great way to kind of bring in technology, education, and health. And it was a great way to help people understand it a lot more.
I think the intersection of that is the future. Really and truly. And a lot of my passion as well has come from that agency that I took and almost felt compelled to take. Although my circumstances were like, oh, I had to have a procedure and everything, it actually was like almost like a wake-up call to be like, actually, this is a great way for me to learn more about my body. Like I've always cared about like skincare and like what your face is telling you. So I looked up like face mapping to understand that when you get a spot certain places on your face, what it means. And in understanding that, I used to get spots here all the time. And I realized that when you get spots here, it's signs of dehydration or anxiety. And I found that when I traced my life back, I was like probably very internally anxious about, I don't know what, I can't remember now, but I also know that I didn't drink a lot of water. And to the point where, timely, to the point where I, one day I was at home with my mum and two of my friends, and we were just at home having dinner, and my mum was cooking, and the kitchen was warm, naturally. And then all of a sudden, it just got really hot for me. So I was walking around my house, and I was like, do you know what, I think I'm just going to try and get to the front room just to like take a minute. I didn't even make it. I collapsed right in my hallway. And like I collapsed, and the turning temperature thing for the radiator was here and my head was here. So I literally missed it by like millimeters. And then we had to call an ambulance. I had an ECG, all of that kind of stuff. And then the doctor said I was severely dehydrated. Like my body just didn't have enough fluid in it. So that's what was causing the dizziness and all of the, and a lot of the spots that I had here. So then I went through like a process of like, do you know what? I'm going to look at the external, so what products can actually help my skin clear up, but equally, what can I do internally to manage this stress? How can I drink more water, etc.? So now I feel like I really understand, and I'm also a believer that if you get a spot on your face, that's the last place it shows up. That's like it telling you, okay, like what the problem is coming out now.
Yes.
Because whatever the problem was or the concern was, it happened internally first.
Yeah. Everyone's metabolism is different. Things show up differently in different and that's even more reason for you to know yourself and understand. Yeah. And I love that story because that's then kind of kickstarted you and your journey in trying to understand your skin, you know, everything, your water levels, your hydration. Yeah. So I think that's really, and similarly, I think I've also, I mean, even though I'm a doctor and trained medically, there's things that happen to you. I think as doctors, generally, we don't look after ourselves as well as we do. We put all our energy in looking after others that you kind of forget to look after yourself. And so when I've been having recently quite a lot of skin conditions. Okay. And thinking that, oh, I'm allergic to something or, and spent so long like trying to figure out what's going on and changing my shower gel. I mean, to the point where changed types of bed sheets, got rid of all rugs in my flat just because I thought it was an allergic reaction to something. I don't have pets anyway. I changed curtains into blinds. I spent a lot of money doing all of this and going to see dermatologists and try, you know, Aveeno oat baths and all sorts of things. I don't use perfume. I couldn't even makeup was very light makeup and not able to moisturize with all the things that smell good, you know, it's just E45 and boring stuff like that. And at the end of it, it was stress. It was stress manifesting in a physical way. Yeah. And I started to kind of learn that about myself, in that I don't show stress, in that, like, you know, I work in a lot of stressful conditions and I'm usually the person that's calm, cool, leading emergencies and so on. But I take on a lot of people's stress and I take on a lot of people's emotions. Yeah. And I just deal with it because it's my job, it's what I do. Yeah. And it also kind of infiltrates into your personal life as well. I'm usually the person that people come to for advice or, you know, and I take on all of that. But where does my stress go? Yeah. My body. Come out in hives, come out in these horrible rashes. And I'm like, what is it? What am I allergic to? What am I? And it's actually it's stress. Yeah. And so once I realized that, I was like, okay, I didn't need to do all of this.
It looks great.
Yeah, exactly. Yeah. And so now it's just, you know, managing that stress and knowing, and it's made such a difference. And I can tell now. And so when there's moments when I'm like, oh, I'm doing too much, I'm getting a bit stressed, I could see my skin starting to, and then I shut it down immediately. I'm like, all right, okay, this is time for you to focus, calm it down a little bit. It's not that serious. Yes. You know, do all the things that you need to do, you know?
And I think that's really important because similarly, like one of my best friends, she gets breakouts on her hands when she's stressed too. Yeah. And it's that same alarm bell that's like, oh, read it back. No thanks. Like, we need to just take some time and relax. Also, there's a big gap in information that pertains to Black women and how their experiences differ from women of other cultures. So the Gynae project, I actually started it with a survey because I wanted to garner new data around how women experience their cycles at the moment, what concerns they had, how much they know about the referral process, all of that kind of stuff. And one of the biggest statistics that came out was that the last time I checked, 78% of women don't know of a local gynecologist in their local area. And whether you visit it or not, you will know where your dentist is, you will know where your opticians is. Absolutely. And whether you need to access it or not, again, at least you know where those things are. And I think there's a lot to be said for the fact that, and it, again, for me, it ties back to that shame piece. It ties back to that taboo piece of like, let's put gynecologists in this secret alleyway down this road, round the corner, that people can't access. And I think data is really what's going to help drive long-standing change. Even again, like thinking about the last stat that I pulled out around how women describe their periods, based on the women that have filled in the survey thus far, 79.5% of women would describe their periods as a nuisance, an inconvenience, or a cause of anxiety. That's a huge proportion of women who have to go through their lives with that connotation. And again, it pulls back to that shame taboo piece that we talked about at the beginning of the conversation. What do you think, how do you think data can help in identifying some of these concerns, helping to move the needle? Yeah, some of those things.
I think data is so important. Data is I think a precious currency for us at the moment, isn't it really? Because that's how we understand what people are thinking, what people are doing, behaviors. And I think for us as Black people in general, our data is missing in the fact that, especially when it comes to health, we aren't we don't get involved in clinical trials too much. So if you think about a lot of the data that comes out of clinical trials that then shapes treatments and pharmaceutical drugs and all sorts is really based on Caucasian, generally Caucasian men, actually. More so than women. And then then it's white women, and then it's other people of color, and we kind of get lumped into that BAME category that I hate so much. Because we don't have the same genetics and the same conditions as Asians or Japanese or whatever. So we don't have enough data in the Black community to help us personalize our treatments and our plans for better health. And specifically the conditions that we affect us a lot more. So I think, we also, we can't wait for these companies and these pharmaceuticals or these governments to make, space for us to collect data. We need to start collecting the data ourselves, which is what I love about what you're doing. It's like, let's just collect our data within our communities and start there and then build up from there. Because then you have a case. When you say that statistic 79.5, call it 80% of women are ashamed and think that a period is a nuisance, something needs to be done. That's a very high statistic. Something needs to be done about that. So then how do we take that data and dive a little bit deeper and understand the behaviors that these women have about their periods? How can we help them not make it a nuisance? It's, for some people, it's always going to be a nuisance, right? It's always going to be something. But how can we try and educate? How can we try and empower? How can you try and improve the quality of your life when you're on your period and other things? So I feel that we really need to put an emphasis on collecting data that's nuanced for us, so that we can then start to put in the work. I'm such a big advocate for Black people joining clinical trials, more work in research, but we need more representation as well, more scientists, more doctors, more whoever that can help improve that kind of data for us, because otherwise we're just going to constantly be in this perpetual cycle of they don't really care about us, we don't have the data for this, we don't know this condition so well, because look at sickle cell, for example, right? Sickle cell affects only Black people. And I feel that sickle cell research could be so much farther than it is now. But it's because we don't have the funding for it as well as we do for, say, there's a condition called cystic fibrosis that only affects white people. And it's a genetic disease, just as sickle cell is. But there's so much more for cystic fibrosis. I remember even in medical school, we would have sessions and sessions on cystic fibrosis, hardly any on sickle cell. So when you come onto the wards and you see a sickle cell patient and a cystic fibrosis patient, you know who's going to get treated better. Because of the fact that we were just drummed in with all this information. And so it's things like that. And I think we can't sit here as Black people as well and wait around for, things to come to us. We need to be chasing these opportunities. And it really makes me happy to see more representation in STEM. men and women, of, you know, people of color, because those are the people that understand our struggles and understand what needs to be done. And so I'm hoping that along with the increased representation and the availability of more data, then we can improve a lot of these conditions that disproportionately affect us. And I think for women specifically and women's health issues, a lot of it is more awareness and breaking down these stigmas and these kind of this shame about talking about things. You know, I think women find it very hard to talk about endometriosis and fibroids and these conditions that are really awful and detrimental, but just so debilitating as well that it's like, if I talk about this, then it's going to make me look like I'm weak and I can't cope, and I'm like asking for, you know,
handouts
exactly.
or like not extra benefits, but like extra help almost. But actually, maybe they do. And that's also like should be fine.
Absolutely, because they're suffering from a condition. You can't, and that's the thing. We need to stop suffering in silence, you know, and seeking the help and advice and services. So I think data is really important, because how else are we going to prove that there's an issue and there's a problem? Data.
The numbers don't lie. The numbers really don't lie. There is so much more I want to talk about.
I know, me and you could chat forever.
There is so much more I want to talk about, but I hope that for everyone listening, this has literally just been an introduction to...
There's more to come.
Yes, exactly, exactly. An introduction to the wealth of wisdom that I'm hoping that this podcast is able to share, well, that I'm intentional about sharing. Before we wrap, I always ask every guest that they can ask me a question about this work or anything else. So do you have a question for me?
I do. My question is, obviously, you know, we've met each other recently and you've been on your journey for quite a bit, but what was the moment that you thought, let me rephrase it. What did you learn most about yourself in this journey? What was something that kind of like really gave you that aha moment?
You know what? I think it was, what I learned about myself is that I'm still resilient. I think starting what feels like a new life at this age and stage in life can be treacherous.
Absolutely.
Can be treacherous. So a lot of my thoughts have been around, should I just kind of go back to what I know? And I thought, this is actually a lot harder mentally than I expected. And I think that's another massive thing I learned, that I knew starting something new was going to be difficult. I didn't realize the mental strain, the mental power and fortitude that you need to maintain it. And I'm only 3 months in. So, and I've got like a lifetime or as long as I feel called to the work to go. So I definitely say the main thing I've learned is that I'm still resilient. I think the aha moment, one of them actually, was when I met you.
Aww,
it really was.
Stop
it.
No.
It really was. It really was. For a long time, I felt like I'd been outputting, but it didn't feel like anything was really conspiring. So when I met you, it was like, of all the people, of all the jobs in the world, of all the ethnic backgrounds in the world, of all the like even vibes of the world, like I just thought, wow, and equally of all the places to meet. It's not like we met at a women's health conference. No. It's not like we met at like a women's retreat, which would kind of be like, okay, you might catch a gynae in this kind of space, or do you know what I mean? But to meet at a completely separate event that we neither of us were going to be at, that's when I felt like, okay, this is the work.
That's
this is the
the
work.
universe.
This is the work. This is literally God saying, and you thought I was not listening.
Here we go.
Here we go. So that would be the aha, and that would be the like prominent learning.
Beautiful. I love that.
That would be the prominent
and
learning.
I'm such a believer of those kind of like energetic meetings. You know, like there's something there. And I never say no to things like that, because I just don't. I don't know. My spirit guides me. And for me, it's about like, I'm not somebody who gatekeeps information. It's hard for me to do that. I just vomit advice. You know, wherever I am, getting my hair braided, I'm in the salon getting my nails done. It's always conversations about anything to do with women, basically. And so when someone comes to me and says, you know, do you mind sharing your... Yeah, of course. Yeah. And I don't think about anything else. Yeah. It just naturally comes. And for me, it's a calling. Yeah. And I'm more than happy. I feel like an honor and a privilege to serve women. Oh, and for me, it's so, like, it's what I've been put here to do. And so if there's any way that I can help, just a little bit, even just, you know, sometimes cracking a smile in clinic when someone's going in an operation, or cracking a joke whilst we're stitching her up after having a baby. That makes such a huge difference, and you don't know that, you know, it's just the kindest and really smallest gestures. 100%. You know? I've had that. So, yeah, I'm really excited for your journey, and I'm really excited to see what you birth. Definitely. You know, at the Gynae Project. And here to help in any way I can. And I'm excited for you to be part of it. Very much so. Thank you. Where can people find you anywhere if they want to? Do you have Instagram? Do you care about Instagram? Do you want to share your social medias? So at the moment, I am going through kind of like a little bit of a transition. My Instagram is private. Okay. It's not really set up for kind of any kind of technical, medical kind of work. Definitely can find me on LinkedIn, and I'm happy to connect with people on LinkedIn. I'm in the process of setting up a website. Yeah. So once that's up and ready, I will definitely share that. So yeah, I'm just also trying to see, I'm going through my own transitional journey from working in the clinical world into doing a little bit more tech and education. So that intersection that you said about education, health and technology is kind of where I sit in the middle. I'm just trying to figure out how to bring all those three things together within women's health. And so I am in this phase of like, reinvention a little bit. Yeah. And see how I can, like, all this advice and all these skills that I have, how can I then use that to the best of my ability to help people? So, watch this space. Love it. Love it. Well, thanks, guys, for listening to another episode of the Menstrual Podcast. Love you. Bye.